Welcome to the Technology Source Virtual Roundtable. Welcome and thank you for being here. Good morning, good afternoon. Please let us know where you're calling in from, maybe what kind of health system you're working in. Would love to hear from you. You're in the right place. Good morning. Good morning, you're at the Technology Source Virtual Roundtable. Good morning in Whittier. Thank you for joining us. Awesome to have you here. All right. Hi in Walnut Creek, California. Good morning. Good morning. Hi in Mountain View, California. Thank you for joining us. Good morning. Where are you guys calling in from? Let us know, what type of healthcare system are you in? Be interesting to hear that. Good morning, good afternoon. We have Mirage, California, and MSO.
Oh, wow.
We have Children's Services in New Jersey. We have Highland, Illinois Healthcare Center. Awesome. Great Plains. Thank you for joining us. All right, we'll get started in just a few seconds. My name is Sonia Moline, and we'll just get started in a few seconds while everyone's trickling into the room. South Carolina. We have a health center in Des Moines. We have, let's see. I love this. Thanks for the chats, you guys. It helps me know we're not here by ourselves. Health ambulance, medical ambulance center in Ohio. Let's see, community hospital in Kentucky. And we have health services in San Angelo, Texas. Good afternoon. Thank you for joining us. All right. Packard Hospital in Palo Alto, California. Thank you for joining us. We have a pathology center in Colorado, multi-state. Great to have you with us. Good afternoon. Well, it's still morning there, I guess. All right. Well, thanks. I think we can get started. We have quite a full room. I know there'll be a few people trickling in, so we'll just have to go ahead and get started. So I'll introduce myself quickly, and then I'd like to introduce the gentleman on today's call. We have two wonderful providers here today, both of them who have a very, very diverse portfolio of products and services. But one thing that unites them is they specialize very closely in the healthcare space. I will introduce our company. We are Technology Source. We're like a technology matchmaker. We work with organizations all over the world to find the right technology solutions to fit their needs. We do this at no cost for the most part, unless there's some RFP work that needs to be done, but for no cost to those organizations. We are paid by the organizations here. Since they don't have to employ salespeople to do the work, we do all of that for them. And so again, Technology Source. My name is Sonia Moline. I have been in the healthcare space for quite some time, was an IT director in that space, and actually hired some of the providers we have here today, and worked with them extensively to work on digital transformation, removing data offsite and putting it in the cloud. And then removing all of the workspace and putting that into the cloud, virtualizing our phone systems and improving internet and networks. So had a great career doing that, and then got to work as a chief sales and marketing officer for a cloud services company called Effortless, and had a wonderful time in experience there. And now I work more on this consulting side, helping organizations find the right products and services for them. Specifically in healthcare, I do hold CHC certification for Hipaa Compliance from the Healthcare Compliance Association, the leading healthcare compliance association in the United States. And without further ado, I'd like to introduce a gentleman named Phil Campbell. And what I'm most impressed with in Phil is that I feel such a kindred spirit there, because we both served in the Navy, and then went on into the healthcare space, and then went on to work for a vendor that we worked with at our healthcare operations. I thought, wow, what a small world. So let me just introduce him. We'll get right there. Got too many chats coming in. Sorry about that. It's covering my screen. All right. So Phil graduated, as I said, from U.S. Navy Academy in '94, launching a 22-year career in the Navy while he was in 3 foreign countries living there. He also visited over 50 countries, crossing every line of longitude on Earth and every line of latitude from 70 north to 70 south via ship, airplane, train, or car. He served as a firefighter and navigator on surface ships, and then transitioned to being an intelligence officer, serving almost a decade on foreign soil. After leaving the Navy in 2016, he became the CIO at Calvert Health Medical Center in Prince Frederick, Maryland, where he oversaw the transition from legacy data and voice to Windstream's unified communications as a service, SD-WAN, and VoIP solutions. He joined Winstream in March of 2021, so he can continue to improve patient outcomes throughout the healthcare delivery transformation. So we're excited to have you with us, Phil. And where are you calling in from today?
I'm calling in from Huntingtown, Maryland. So it's just the next town up from Prince Frederick. Yeah.
Okay, cool. And then also on today's call, we have the CEO of Effortless. His name is Benjamin Gehart. Ben's career started over 20 years ago serving casinos in the healthcare, I'm sorry, not in the healthcare space, in the casino space. Casinos like Tropicana, Hard Rock, Cosmopolitan, up and down the Las Vegas Strip, helping them with their digital transformation. And in that, career, he and his team built Effortless. And Effortless then kind of went on to naturally serve other highly compliant industries. Because as you can imagine, in casinos, you have applications running simultaneously. You have huge high demand for privacy and data privacy and security. And so that was sort of a natural transition for Effortless to move into the healthcare space. First kind of serving, just regionally around Nevada and Southern California, but then kind of spreading out throughout the United States. And I think when I was there, there was over 50% of the clients at Effortless were in the healthcare space. So it's a kind of a natural fit for Effortless Office.
Yeah, absolutely. Thank you, Sonia.
Great. And Ben, where are you calling in from today?
I'm calling in from the mountains in Southwest Oregon. So
okay, awesome. Yeah. I know it's beautiful
there. My internet's been pretty good, but I have 3 internet connections, one shooting off a tree 150 feet up to some city. So it gets a little shaky sometimes. So I'm waiting for the start. Yeah, so it's been pretty good.
The remote work is so fun, isn't it? Yeah. I've been working remotely for over 1.5 years. And even before that for, gosh, it seems like 10 years, especially being enabled by an organization like Effortless Office, who enables workers to, work remotely with, seamless access to their applications and those types of things. So, but now I'm up in Northern California, up in the mountains, kind of similar to you, Ben, where the internet's a little scary, but we're doing good. We got redundancy in place, so we should be okay, knock on wood. I have some of my other team members here today if anything goes haywire, so we'll be taken care of. So let's get this conversation started. I have a ton of people on the call, and I just want to take care of some housekeeping really quick. If you do have anything to say at all, we have a questions and answers box that you can type a question to. We want you to do that because this is a roundtable. We want to hear from you. We want to hear your voice, your questions, your comments. So if you use that, we will actually reward you. In fact, we're giving away from Effortless something I probably really need. It's these little tiles that help you. So if you lose something, you can find them again, I think is what it's called. They're called tiles. And so they will ship those out to your house. And correct me if I'm wrong. Is that what we're doing, Ivara? I think that's right. Okay. Okay, cool. So that's what we're shipping out to 4 lucky winners, as well as a cool prize from Winstream. And I will figure out what that prize is, but it's a cool prize at the end. And then we're also giving away 15 lunch certificates for Grubhub or Uber Eats, unless you're in the mountains like Ben and myself, and you don't have access to Uber Eats, but you can give it to your friends in the city. You know, everybody likes those. So, so cool. Well, without going into too much more housekeeping, just one more thing. Please, again, use the chat section for chatting, and then questions and answers for those prizes. And then I have Will on the call today. Will is a senior technology advisor with Technology Source. And I just wanted to introduce him. I also have Brad Daniels and Eric Applefield. Brad is a sales engineer with Winstream, and Eric is a director of cloud over at Effortless and Cloud and Channel. So I'm happy to have all these smart people on the call. And so let's move into this concept of how healthcare is being transformed by cloud. So, you know, some of the things we've learned here during the pandemic are, you know, they're all over the board. Some funny shows we've gotten to hunker down and watch, you know, some interesting behaviors we've learned that people will take on during a pandemic. For example, I learned that there is a universal human need to wave at the end of a Zoom call. I don't know what it is, but I always do it. And it's funny because I don't do that when I'm like walking out of somebody's office. I'm not like, bye, you know, but it's just, I can't help it. And I'm not the only one. I read a study that it's just a thing, you know. And then also I learned that DR plans for pandemics aren't just a funny exercise. So when I was a very young IT director, we always jokingly referred to our pandemic response plans as the zombie apocalypse plan. I had no idea at that time how serious a pandemic could be, or how plausible that it would ever, you know, that this plan would ever come into effect and we would actually use the plan. And fortunately, I had Effortless and organizations like Winstream written into our plan, because those organizations that I left and who are now using those disaster recovery plans. So it's cool to see those types of plans in effect, and that they were actually useful. And we learned, you know, of course, that there's a greater need than ever before for digital transformation. You know, those projects that were getting the yellow light or the red light in prior to the pandemic, now, you know, they're getting fast tracked, more security, you know, increased disaster recovery, increased and improved access to, you know, applications and data from offsite. And there's just so much more. So I'd like to hear from Phil, and just kind of learn a little bit more about other ways that the healthcare industry has been transformed by the cloud.
Okay, great. Thanks, Sonia. I'm going to go ahead and share my screen. All right, so you see my name there, Phil Campbell. As Sonia said, I just fell into this job, so I have no idea how I got here, but it was an interesting and cool journey to get here. So, but one thing I always tell every client since I started in this position is, I'm not a salesperson. I don't have quota. I don't sell product for Winstream. What I do is provide consulting on the inside of Winstream to help Winstream's product and sales staff do a better job of addressing the needs of the healthcare industry. But I'm also available to the healthcare industry itself. If you have questions or concerns and want to reach out to me, even if they're not related to technology, you just want to talk to somebody that has been through some of what you're going through, you're welcome to reach out to me. Happy to talk. So I don't push product. I don't sell things. So all of that said, marketing wouldn't let me do this unless I put this slide up. So I will tell you a little bit about Winstream. Winstream's a great company. The reason I came to Winstream is because of the partnership that Winstream offered me as a CIO. You know, to work with them so closely and to work through all the different transitions and challenges that we had. It was really amazing. With our legacy provider, you know, who do you call when you have a problem? I don't know, and they don't know either. With Winstream, it was, oh my gosh, which one of the 10 people do I call? Because there's all these people at my fingertips who want to work with me, who want to make things better, who want to help us. And so I was really impressed with that as a company. So that's why I came across. So you see, we have a pretty strong healthcare presence, 7,900 customers, 55,000 locations, lots of cool stuff we're doing. Encourage you to go to the website and learn. The thing that I think is most interesting, most neat for healthcare is our we will commitment, our service guarantee. This is unprecedented and unrivaled in the industry. If you transition to Winstream, we've got a lot of guarantees in place, essentially for a period of time, your money back, which sounds crazy for what we're doing, but for the kind of business we're in, but it's how confident we are in our solution and the service that we provide. So I definitely encourage you, if you're looking at a transition, put Winstream on the list of vendors to look at. So I've done my what marketing says I have to do, so we're good there. Well, I'm sorry, I still have to do this. So this is more about Winstream. We're in the Gartner Magic Quadrant for UCaaS. We've won some awards for SD-WAN. So we've got the chops to deliver the service. So let's get on to the real meat of the discussion here, and talk about cloud transformation in healthcare. You see there at the top, it used to be that moving services to the cloud was either sort of only for the most innovative or wasn't really realistic, because our hospital was located on a peninsula here in Maryland, and I used to joke that we were one drunken backhoe operator away from not having a cloud. But with the advent of all the services that are out there, you have to make that transition. It's just table stakes anymore. You got to start moving services to the cloud. So whenever we made the transition, here are some of the things that we realized. And so I'll talk you through some of these and tell some stories, because I'm from Louisiana and that's what we do. So first thing, reducing cost. Everybody talks about reducing cost, and there's lots of articles out there that say cloud doesn't, it's all a wash. But I'll tell you what, one of the things that I found in the transition to UCaaS and SD-WAN was that it actually did reduce our costs. First of all, it took costs out of capital. Now, I know hospitals always carry capital, and they always will. But a lot of CIOs have access to capital where they might not have as much access to OpEx. But when you start to work through all the numbers, depreciation and all that sort of thing, for instance, for me, I was going to replace a PBX, and that PBX, if you depreciated it over the appropriate amount of time, well, obviously that comes out of your OpEx budget, and so I could reclaim some of that money to apply against the cost of going to the cloud. So that was a piece of financial literacy there that made a difference in our decision. There's the lease versus buy discussion. So whenever you move to UCaaS, a lot of times you're provided the phones as part of the per seat license cost or part of the overall deal. You don't buy those phones. Those phones are provided to you, and so if one of them fails or breaks, you send it back and get a replacement. So you no longer have to manage those devices. Now, obviously, if you damage the device, there's a discussion to be had there. But more importantly, I think what the cloud transformation does is it allows you to predict your costs today. This is one of the challenges I had whenever, for instance, I was buying storage. We were due for a storage refresh. Okay, well, I've got to buy enough storage. We're gonna lease this thing, lease to own over 5 years. And so I've got to buy enough storage today that it's going to meet all of my needs 5 years from now. So I'm spending today's dollars to buy storage that I'm not going to use until I get to 5 years down the road. More importantly, I have to overbuy because I don't know what that capacity is going to be. So I have to buy a little buffer in there, and it just didn't make any sense. And so moving to the cloud, though, means that you buy the capacity you need today and you stair step up as you need it. Second piece, uptime. If you have your own PBX on-prem and your PBX goes down, you're down. There's no alternative PBX to move to. But whenever you move into the cloud, it opens up this opportunity to have graceful failover between different locations, the ability to move things between places. And I'll share two stories with you there. So here in Prince Frederick, they were widening the road going through the center of town. Again, we're on a peninsula, so all the internet just comes down one highway down through the center of the peninsula. Well, This dump truck was laying asphalt at 2 o'clock in the morning, drove right through town, pulled down the internet for the entire county. I got up the next morning, drove into work, nothing. At 10 o'clock in the morning, the next morning, my stepson texted me because he's doing school from home and says, "Hey, is the internet down?" I don't know. So I reach out to my network engineer. "Hey, you hear anything about Comcast?" Because that's the service I had at home. And he looks, he logs into Windstream's portal. "Oh yeah, Comcast is down." "Oh, okay. Well, we had SD-WAN, so it just switched over to Verizon. We were the only location in the northern half of the county that had internet, and we didn't even know that there was an outage. So it was really, really an opportunity to be a hero as a CIO, which is fairly rare. Then there was another time that we had a fire in our administrative building. So we're talking about a different kind of uptime. It's uptime for your staff. We had a fire. It took down the switch in the closet. And then we weren't able to, our finance department wasn't able to generate bills and weren't able to code. My own department, information services, wasn't able to work. This was a pretty devastating fire in our admin building. So, but because we were on SD-WAN and on UCaaS, it meant that we were able to move everyone to different offsite locations, hook them up to the internet, and within 24 hours, we were back to full operation. If we had been on our previous solution, our legacy solution, moving all of those phones and PRIs and all that sort of thing would have taken weeks. So, so the uptime is not just about your network uptime, the uptime is about your business uptime as well. Enabling Hipaa compliance. You know, whenever you're trying to manage Hipaa compliance within your organization and working with your BAAs and your partners and all that sort of thing, it can get really mind-boggling. But ensuring that you're reaching Hipaa compliance whenever you move to the cloud, you know, it's baked into a lot of these services because they realize that if they're going to service healthcare, they have to do it. And so it really becomes sort of a headache just taken off the plate. You don't have to worry about it as much. Information blocking compliance. This is the rule that everyone's scared of now in healthcare because it seems, Phil Campbell's personal opinion, it seems a little arbitrary at times. Patient walks in and asks for information. They don't get it. They can go back to the government. You can get fined. The reason for them not getting it can be, you know, whatever. And I've seen some reports of health systems being fined for things like, you know, storage outages. They just couldn't get to the file, but it didn't matter. They got fined for it anyway. So moving to the cloud allows you to spread out some of that surface area and provide some backup there, sort of going back into that uptime piece. And then finally, patient and clinician communication. You know, the ability or the requirement now, and we saw this during the pandemic, the requirement for patients to be able to reach out to their family whenever their family members aren't able to be there. And this exists even, you know, outside of the pandemic. You know, you have family members who are located across the country still want to communicate with their loved one who might be in their final moments. And so having a reliable connection that allows all of that to happen is really critical. And you want to be able to do that through SD-WAN. Same thing with the UCaaS solution, being able to provide that phone line to that patient. And then finally, on the clinician side, you know, the different cloud-enabled products that you can use now, whatever you can unify your communications, means that it's easier to not only just do regular, you know, make phone call, that sort of thing, but also it allows you to meet compliance requirements easier. So for instance, when a clinician, when a physician changes an order for a patient, if the nurse has been texting the physician to get that change, and then the physician has to issue a change, well, you know, CMS rules say that they have to switch to voice so that they can have a conversation, a live conversation. So that the nurse can ask any questions, get any clarification they need before they change that order. Well, you know, that's really tough to do if you've got a lot of siloed communication paths. But under a UCaaS solution hosted in the cloud, you're able to provide that ability that the nurse can be texting because it's easier. They're communicating with someone else, so it's easier for them to text. But then transition over to voice and answer that. And get that changed to the order, and then go back to text and optimize their workflow. So those are pretty important pieces. And then sort of as part of that uptime and the clinician communication piece is some really neat concepts that are coming out of this. So for instance, at Calvert, we worked with Winstream to actually develop a solution called Windpod. So what Windpod did was take that data center that's out in the cloud and actually move it on-prem. So we have a hybrid unified communication system where that device sitting in our basement sits outside of our network, managed in this case by Winstream. But what it does is it allows all the phones to register to that device. And then if there's an outage or some kind of failure of whatever, for whatever reason, hurricane or that backhoe operator, then it can fail over to copper, or if there's still an internet connection, say you've got some tertiary connections or something like that, you can fail back over to a data center in the cloud. So there's some really interesting solutions that provide some really neat backup for mission critical communications. So I've flown through those things in the interest of time, but I want to open it up to anyone who has any questions about any of those discussion points that I offered.
Yeah, thank you, Phil. We did have a quick question or two. And remember, guys, we want your questions. It's really important so that we know, we're answering everything that comes up. So whatever you think of. So one of the questions, though, we did get from Trudy L as in Lima. She says she's interested in learning the disadvantages of health information in the cloud, as well as the advantages. And then if there's any limitations there. So I know this word cloud gets thrown around and it means a million different things to different people. So, but I guess just from in general, Phil, if you could shed some insight on that for Trudy. And thanks, great question, Trudy. And we're going to put your name in the basket to win some fun prizes. So thank you.
Sure, Trudy. Thanks for the question and good luck with the drawing. Advantages and disadvantages. We talked about a lot of the advantages already. Disadvantages of going into the cloud, I think are related to what kind of reliability you have to the cloud, what kind of reliability of the connection you have to the cloud, which is where services like SD-WAN come in, because SD-WAN sends all the data out across all connections simultaneously. So what that means is if one connection goes down, it's not that, oh, everything that was going down that path is now lost. It's nope, everything's still going down the other paths at the same time. And so, and you can start to work rules to change that logic as you have a graceful failover. But if all you have is a single connection into the cloud, that's definitely going to produce some challenges. I think. Frankly, one of the biggest, and I don't necessarily think it's a disadvantage of cloud, but it's something about healthcare. Healthcare, as we all know, is an uber conservative industry, and our clinicians are working very hard, and their workflows are already just maxed out. And so, introducing something new and then saying it's in the cloud generates a lot of questions and a lot of unease because it's unfamiliar. What is the cloud? So I would say that in any transition to the cloud, one of the most important pieces is making sure that you do some education with your staff, with your workforce, help them understand what it means to be in the cloud and the kind of and the positives that it offers, and then talk to the things that you've done to mitigate the potential negatives. I see another question there from Erwin. How are the remote doctors and healthcare workers protected when using the cloud on the road? Sonia, can I take this one?
Yeah, so this is Erwin B as in Bravo. We will get you in the drawing, and then we have one more question to go.
Okay. So, Erwin, that's a fantastic question. I would say that this question is top of mind for a lot of CIOs right now in healthcare because doctors and healthcare workers are dispersed and on the road more, especially when you get outside the hospital setting where it's not so much one-on-one. It really comes down to how the solution is engineered. And whenever you work with a provider like Winstream, security is always built into it. So you might not have heard yet of this sort of new frontier in technology called SASE, SASE. And it's basically security baked into your network connectivity. And so whenever you move to a solution that is SASE, then what that solution does is it means that it essentially moved that firewall from on-prem up to the cloud too. And so that way, anytime your folks are accessing your cloud resources, they're also protected.
So Phil, if I could jump in too. So additionally to that, a lot of the UCaaS type clients, so if they're using mobility or they're using laptops, those SIP endpoints that are present on those devices use certificates with TLS for security, so that you have that encrypted traffic going from those endpoints back into our hosted environment.
Thanks, Brad.
Yeah, good. Well, and so a couple more questions. This one is about security. And so what are the major privacy challenges of cloud computing in healthcare? And I know that we will want to definitely point this question to Effortless as well, since that's one of their main challenges that they solve. But Phil, as it pertains to the network, what are some of the privacy challenges in healthcare? I mean, I think that's the #1 challenge, right? Or one of.
Yeah. No, you're absolutely right, Sonia. So I think, privacy in the cloud really comes down to building relationships with your vendors where you can trust that they're actually doing the things they said they would do to secure your data. And again, this is where I thought, Winstream was just fantastic with me about building that relationship. But it's about understanding what they're doing. If they sign a BAA with you, are they actually doing the things they obligated to under the BAA? Are they going to uphold their end? Obviously, I don't think there's really a difference anymore between cloud and on-prem in terms of vulnerability to being compromised. Just look at all the ransomware attacks that are happening. I mean, they're happening to on-prem systems. So I think that anymore this discussion is about just purely securing your data wherever you store it.
Yeah, absolutely. Well, great. So a couple more questions. This one is from John B as in Bravo. He says, if an SD-WAN provider is not also providing one of the internet circuits, how do they keep their business connected during an internet outage?
Okay,
great. Take down, or you got it, Phil?
Yeah, I got that one.
Okay.
Rada, you had to go, I think, didn't you?
I do actually, but yeah, I would hang
there. Okay. So
but it's just so fun. He wants to stick around.
So this was exactly the situation I was in at my position. Winstream was an SD-WAN provider, but they were because we weren't directly on their network, they were leasing circuits to support us through several different vendors. And so, if you're asking during an internet outage, well, sort of the whole idea of SD-WAN is that you've engineered things such that there's multiple paths, and so it would really be a unique experience to lose everything. But I will tell you that with Winstream as a partner, anytime we suffered any sort of outage, even when it was, it didn't impact service at all. Winstream was Johnny on the spot with making the phone calls to the providers that they had leased those lines from. And so I never felt like I was on my own or there was this finger pointing about it's not us, it's them. That was never the case. They were always advocating for getting our problem solved. Brad, anything to add there? Did I get that right?
Yeah, I would just say, but the underlying carrier, it doesn't matter to us. So what we call the underlay of the circuit. So even if it's not our circuit, even one that we've provisioned, we can utilize that circuit. And so, to Phil's point is you've got those disparate vendors, so you're not, all in the same bucket of connectivity. In the event that one does go down, you fail over automatically to the other circuit. And it doesn't matter who the underlying carrier is to us, right? So we can do the overlay, which is the application component from the SD-WAN over any circuit, whether it's another carrier, you've got a contract currently with MPLS or something, we can still utilize that even though it's not ours. And then when we start managing that, we have the visibility over that network and are able to proactively work on mitigating any outages, to Phil's point about the, opening tickets to get those resolved.
Great. Yeah, so many advantages, right? And that's what it's all about, is just creating so many advantages for you and less advantages for the downtime and less advantages for the hackers and, reducing all of those risks. So, well, super. We want you guys to stick around because we would like to actually kind of open it up as a panel towards the end. But I wanted to maybe stop the screen share here and then turn this over to Effortless, who is on today with us as well. And so we'd like to hear from you, Ben, at Effortless, if you want to hop on. Thank you. So we'd like to hear from you and hear, what it is that Effortless is doing and what you guys are seeing, how cloud is changing healthcare. You there, Ben?
Yeah, I'm here. Yeah, thank you. I'm going to keep the video off, Sonia, just to ensure that I don't have
Got
requirements. No problem. So, yeah, how cloud has changed healthcare. So, Vara, if you can go to the next one. There's probably a few of these, Sonia, due to the time that we'll probably skip over to get right to some meat of it. So I'll have Vara advance those. So today, as you guys are on, everyone on this presentation, 35% of healthcare organizations held the majority of their infrastructure data in the cloud. The healthcare industry is a very progressive industry. What we're seeing, while I suppose traditionally they're conservative, we're seeing them embrace the cloud primarily because they don't traditionally, or at least to date, they haven't been able to address, or they don't even know how to address compliance and cybersecurity and protection of data. So if we look at some of the market drivers, they see better storage, flexibility, scalability of data offered by cloud computing. And then you do have that cost efficiency of cloud. It's flexible. Phil talked about the OpEx versus CapEx. But the biggest thing we're seeing by far is compliance and cybersecurity. Those are the two drivers that we're seeing people wanting to address in the cloud. And again, it's primarily because they don't, or essentially you potentially on this phone, don't know what you don't know, right? And that's a key element. So this slide, I think this might answer some of the questions I saw popping up. So public, private, or hybrid cloud. It's interesting because the public cloud isn't, we see, some disadvantages with it. And what we're finding is that a hybrid model is definitely the best approach. So you have the public cloud, you have Salesforce, you have Amazon, you have Azure. We have our own private cloud. So we built it out, and it's a result of our experience in the casino space from 2005 on. So we built out our own private cloud. It's a SOC 2 Type 2 setup. It's across the country. We're geographically redundant. We're in tier 5 data centers. And the reason we built out our private cloud primarily was because there really wasn't a public cloud then, but we kept growing it because we saw that the need for flexibility and understanding around compliance and cybersecurity, our ability to implement the proper measures was much easier by continuing it to do it on our platform. And the hybrid model is what we're seeing all of our clients, basically their setups ending up, because there's a lot of legacy apps, right? In the healthcare space, lots of legacy apps out there still, and it's hard to put some of those in a public cloud. And so our private cloud, since it's essentially, it's almost like taking your server room and any customization you have on your platforms, we're able to replicate that in our private cloud. So we don't have to always get into changing how you operate or telling you have to change the application you're using. I think I saw someone pop up that Epic question. We have a lot of experience with that product, but we're finding that the hybrid network is the model. So we can keep stuff on site where necessary, but also put in the public cloud or our private cloud, what makes sense to put out there. For effortless efficiency of services, it's, managed IT services. We're a managed service provider with a private cloud. And so it isn't a one size fits all. We work around what the client's needs are. But what's key is that we're a true enterprise provider. So we're 24/7, 365 support. All of our employees are in the United States. We do system design and integration. We always do an extensive audit of our clients. And so that we're able to replicate and make the processes and workflow be the same essentially as what they're doing now, because as Phil talked about, getting people to change is not easy. And a lot of times there should be no change. Businesses are operating it from a workflow in a really good manner. And so we want to be able to just take what they're doing, but leverage all the cloud pieces that work. DaaS, VDI, some of you may be aware of this. So that's desktop as a service or virtual desktops. This has been a massive driving force what people are going to, especially, with COVID. I think we have a client on this I saw on the list of attendees right now that was part of a 700, 800 user organization that moved over to us about a year and a half ago. And they're leveraging the desktop as a service because we were able to provide a secure compute platform, not just application, right? So it's not just Office 365. We're able to put their actual whole desktop, their Windows 10 desktop, in a cloud environment and wrap compliance and cybersecurity around that. And then users have the capability of working from anywhere in the world securely. It's a lockdown environment, and DaaS is growing tremendously. So data concerns and cybersecurity, data security, and privacy concerns. This is huge in the healthcare. And what we're seeing is that, practices, MSOs, we have MSO clients, pathology, cancer organizations, doesn't matter what they are. What we're finding is they don't know what they don't know, but they know they have issues or they have to address these. And so they're wanting to go to the cloud for those reasons. There's complex regulations governing cloud data centers. We meet all those. We understand it. We actually have a dedicated compliance division. And so it's staffed just to address compliance. And then you have traditional with advanced cybersecurity and compliance solutions. And so when I talk about traditional, it's kind of the antivirus, the basic stuff, which really doesn't address or tackle a lot nowadays, but you're having to layer everything together to accomplish the goal. So this is a huge offering we have, and it's addressing kind of the needs of businesses out there. So we're offering, or we have been offering for quite some time, compliance as a service. In compliance, by definition, is doing IT in accordance with rules and creating the written evidence necessary to survive an audit, investigation, or lawsuit. So it's not the technology; it's everything around that. So we've provided compliance as a service. It's easy to use compliance portal for collaboration between effortless IT support, internal auditors, and subject matter experts. We work and deliver the primary reports, worksheets, presentations to assist your internal auditors in keeping your compliance efforts on track. We deal with email security, phishing, and then eliminate the need to invest in high-end consultants. This is key because what we're finding is that, and we didn't know this until we started offering this, we're seeing the traditional, compliance and specialists around this space, charging 10, 20, 30, 40,000 or more for kind of a single engagement. They come in, they audit, and then they provide the reports, and then they got to come back the next time. Or you're having to hire a compliance officer, which generally are six-figure employees. We eliminate all of those things. And so if we look at our compliance manager consulting services, you're getting a compliance manager assistance. There's actually a web portal that our team delivers to you, and they provide the assistance. They help do the policy and procedure templates and execute those. And then they're providing consulting on the existing policies, the use of the templates, and ensuring it's ongoing. So it's a monthly service that helps ensure that you're continuing to address compliance concerns and educate you, right? It's our job to present to you changes in the industry, new regulations and laws coming into effect. And then why has Compliance Manager become top of mind? The investigative capabilities that come along with the compliance effort are exponential, and that's meeting federal regulations and avoiding fines. There's tools that assist in looking into what is happening to your network. So we're continually analyzing these things. And we have clients that just use us for compliance as a service, but most of them end up moving or going to us for their cloud or compute platform once they see the services we can deliver, the cost benefits, and kind of the overall technology platform that we provide. And then you have uncovering employees or vendors that have privileged access. We see this quite a bit. We recently did an audit for a large organization, over 1,000 user organization in Arizona, where we did basically a basic audit. And next thing we know, they had over 100 employees with privileged access to, because permissions weren't set up correctly. IT sprawl is an interesting thing, right? IT departments don't go out to not do things correctly, but over time, 5, 10, 15 years of just having to address immediate concerns, you end up with an environment that is not secure, it's not safe, it's not compliant. It's just kind of the nature of it. And so we're able to uncover all of those things. And then you have the metrics again that go with it, the reporting and all the pieces. So if we look at effortless cybersecurity, and this goes with compliance, right? These, compliance for some people wraps underneath cybersecurity. We take a layered approach. It's not one size fits all model. It never is. There's a lot of companies out there that try making it seem like it is, but it's not. You have cloud, on-premise, and user, remote user protection. And that's whether or not they're using a traditional endpoint, a laptop. And this was a big one with COVID, right? People had to send users home, and it was, oh, how do we secure them? They're working from home. And then there's this misconception that VPNs was that was the answer. And it's really not. Once you really dive into it, you're able to start exposing that. You have a user you sent home with a laptop that's on their home network, that their kids are playing their PS4 and their Xbox, and you have smart TVs and devices. People don't secure their home network internally. So that user is connecting back to your corporate office with a VPN, but their computer's on their in-house, in their home's network. It basically becomes a gateway to hop right into a business. And we have a 3-part webinar series that we've done with Sonia that actually goes into this stuff extensively on that series. But VPNs, they're very, very dangerous. It takes a lot of time, IT department effort, and cost to truly secure that when you really dive into it. We basically rely on security operations center that is internal, and we use a third-party organization that kind of watch what we're doing also. So we take it very serious. And then we are SOC 2 Type 2. We're able to do detection in less than a minute, human response within 11 minutes. And it's very, very cost efficient. When people look at what we can do and the services we can provide around this, it's a fraction of the cost. Barb.
A lot of good information and stuff that I'm sitting here shaking my head going, yep. So we have some questions. Is that good?
Yeah, perfect, Sonia.
Okay, perfect. So this one comes from Demetrius F as in Foxtrot. Demetrius says, ransomware has been a major problem for many organizations, including healthcare. Does going to the cloud provide more security against that particular attack versus the traditional on-prem solution? And have there been studies, or have you seen personal experience where ransomware has been a problem and that cloud has been a solution? And thank you, Demetrius.
Sure. And Sonia, if you don't mind if I jump in a little bit in support of Ben. So moving to the cloud is not necessarily what will provide levels of security, but being able to manage those environments and being able to incorporate public or private cloud environments into the solution and the architecture relies heavily on still being able to implement security and BDR plans. So being able to back up the data, being able to recover the data, and have executable plans to essentially protect and create hygiene around that data is super important. So it takes a very layered approach to all of these solutions. And it's a matter of being able to look at your compliance efforts as well as productivity and your security that you need to employ to deliver a compliant solution.
Yeah, and I mean, just with ransomware in particular, I think that's an area where Effortless really shines. Should your organization be subjected to ransomware and on the Effortless platform, your data is backed up multiple locations, you have multiple instances of every user's desktops. And so even down to the desktop level, their icons, where their printer settings, all of that, which could be really impacted by some ransomware. Those types of situations are, kind of, just a momentary blips compared to huge, outages where data is held hostage and Bitcoin needs to be exchanged and all of that. So, Effortless would be a really great solution for somebody's looking for, ransomware protection.
For sure, Sonia. And with the, the advent of many of these EHR and EMR platforms now being SaaS and web-based environments, what we're seeing is that when the Windows networks, when the networks are built and the domain is extended and Active Directory with multi-factor authentication is employed, these are other points of insurance and security that can be layered into public and hybrid cloud environments that provide that, that safe access and secure access.
Great. Okay, so quick question from Cal H as in hotel. He says, how do you ensure your hybrid cloud is not susceptible to hackers? What is the encryption scheme? Maybe we don't want to tell everyone what the encryption scheme is, but just for a high level overview, could you speak to that, Eric or Ben?
Sure, absolutely. So one of those vehicles is a DaaS environment, and when that user is authenticating in a DaaS or VDI environment, which is essentially a piece of software or browser that allows them to have access to their desktop in a secure data center environment, that encryption, that method of authentication is done with the username and password, something you know, and then something you do, which is an element of multi-factor authentication, which ensures that that user is accessing the system is in fact the authorized user. And then that transmission is actually is encrypted all the way through. It's a visual and audio full codecs are implemented so that it's secure, but it's totally encrypted traffic back from the private data center environment to that.
Yeah, we're built on VMware. So our whole platform is, I'm back, Sonia, sorry about that. So our whole platform is built on VMware, and for the technical people on the phone, we're a complete Cisco UCS platform with numerous other layered technologies on that. But VMware is the virtual platform that we're built on, which has native encryption into it, and then we're layering on top of that.
Okay, and then another question about that, actually. John B as in Bravo says, how much bandwidth does the typical virtual desktop require for my organization?
So it does vary. We generally find, 500 kilobytes of desktop pretty good. It can actually work with less than that, but it increases it from there based on how many screens they have and then other applications. So, I mean, it can increase to 1, 2, 3 megs if people, in other spaces. So we actually have engineering firms, full 3D modeling software on our virtual platform.
Great. And then I'll open this question up to both Phil and Ben and Eric. So this is an organization, Fatin M as in Mike says he's interested in managing their growing data concerns, tools to filter through data, keeping the integrity and safety of it. Just what's a good recommendation for this organization? Thank you. Great question.
Eric, I'll defer to you for our side on that. Metrics, we have quite a few.
Yeah, and Ben, I think it goes to each individual implementation. What's nice is that we have multiple enterprise solutions for delivering and securing data and compliance. So some of it is just pure reporting, and some is live in immediate responses to nefarious activity. So it's a blended solution. There is no one IT or security solution that we are implementing that's going to cover all threats and concerns. It very much requires us to take a cohesive look at the networks, and that's sometimes multiple networks in different environments, and layering on these various security approaches.
Yes. Okay, next question. So the cloud has many advantages. Would you be willing to kind of just go over some topics on the integrity of those advantages and where you see cloud just in general? This one's from Moez A as an alpha. So interesting question. I think he's trying to compare legacy systems to cloud and kind of just in general where we've come. If you want to just, it's a bit of a heady question, but we appreciate your good questions, guys.
Yeah, absolutely. So, and you're right, it is a heady question, Sonia. We could take this offline for sure. But the thing is, you know, most companies could never afford, especially in the mid-market or SMB space. Well, I don't want to say they can't afford it. A lot of businesses can, but they look at the ROI, and to try to implement what we're doing on the platform is hundreds of thousands of dollars into the millions a year to put the equivalent of what we do onto your local in-house solution or network that you have, or IT room, servers, compute, et cetera.
Yeah, and I mean, just for me, seeing the transformation, and this is where I get a little bit passionate here, is seeing an organization who's spending a ton of money to manage legacy IT systems. We always used to say shoestring and bubblegums holding things together, and they're really struggling, but they've become just immersed in that lifestyle, and they don't even, you know how to get out of it. And it's interesting because a lot of times when you see that transformation happen, you know, just like Phil said, they save money, right? They save money. They save, you know, potentially patients' lives, right? Because patient can get through and speak to the doctor they need to talk to. They can get access to the data they need to get to. I mean, we all take it very seriously. And I get a little bit passionate about it because I've seen the transitions and the transformations that have happened for organizations. I mean, you can literally talk to the organization if you want to, about any of these solutions that we have. And they'll tell you, you know, straightforward, look, we saved money. We were, you know, by implementing these solutions, we improved, you know, data privacy. And, you know, Ben mentioned that you could get rid of a compliance officer. Yes.
There's one thing around that, and that's, you know, IT departments, traditionally their job is not to be compliance officers, right? And right. So, and you're definitely in that you don't know what you don't know state, and it's a whole industry compliance. You know, for us, that's why we have a dedicated IT, you know, compliance division with staff people that's all they do every day, is ensure that we're implementing those practices and policies and software, and you know, whether it's social or technology, on our cloud, and also on your stuff in-house, or in the hybrid with both connected.
Yeah. Well, great. We've had a really good conversation. I encourage everyone on this call to continue this conversation. We work with over 500 different providers in this cloud space, and we brought two really wonderful ones here today. But we would love to continue these conversations. We match you directly with the organizations if you want to speak with them to get, you know, advice, quotes, you know, services, products, whatever it is that you're looking for. So we want that opportunity. So reach out to the advisor or the agent or myself who invited you today, and we will connect you directly with Ben and his team, and Phil and Eric and all these wonderful people on the call today. And so I did want to do some drawings really quick. And for those of you, I have Joe M as in Mike in here. I'm going to put Fatin M again, who didn't get a chance to have your questions read. There's a bunch more that we didn't get to, guys. I'm sorry about that. But we wanted to go ahead and do that drawing. So the first one, well, you can't even tell. All right. First one is, this is for the tile, and it's Fatin M. So congratulations, we'll be sending you one of those tiles. The next one is, and then I know Effortless has a $200 giveaway for 3 customers on the call today who are interested in the Hipaa Compliance audit or internal audit. So how are we gonna give those away? I wasn't quite sure how we wanna do that, but here's the tile while you guys are thinking about that. This is Demetrius F as in Foxtrot. Congratulations. Good job. Next question we have is Moz A as in Alpha. And those are for those tiles. So if you lose anything, now we'll be able to help you find that. What a cool giveaway. And then this last one is John Bravo. We will be sending those over to you. So please reach out to Will or myself, and we'll make sure to get those to you. My email address is just sonia.m@technologysource.com. And did we have any idea how we're giving away those $200? Should we just do a offline drawing at the end?
Yeah.
Okay.
That sounds
yeah,
perfect.
because we don't know. I don't know how to give those away, but if you were on the call, you may have access to one of those giveaways. We'll just kind of go with the first people that logged in. So, and that's what we'll do with the lunches as well. So we'll be sending those over to you. But thank you so much, you guys. I know this is a complex topic, and I know it's something that we're all really passionate about. And, you know, Will, I've seen, you know, the transformation in your customers and how you've helped them. It's just so great. I mean, you work with a huge hospital system over in Tennessee area. So, I mean, I know just watching the transformation of the organization grow and change. And it's awesome to see how these things that we all, you know, do on a day-to-day basis are applied and the lives that they change and the organizations that they improve. So happy to help make those connections for you. Thank you again. We'll see you in 2 weeks when we have our next virtual roundtable, and everybody enjoy. And I'm going to wave goodbye because it's the end of the Zoom meeting and I can't help it. See you guys soon. Thank you.
Good job.